This video will walk you through the process of ordering insulin for inpatients at San Francisco General Hospital. We'll be using the test system, which contains no real patient data. The management recommendations made in this video are per an attending endocrinologist, but may not be applicable to every patient, so use your clinical judgment as always. After selecting a patient, select insulin orders from the left frame. The insulin ordering screen has been customized to help you safely and efficiently manage patients with hyperglycemia. Here you'll find all information about recently recorded finger sticks and the corresponding insulin dose administered, all of the current insulin orders active on the patient, and the list of insulin-related patient care orders. You'll also have access to order sets designed to support best practices when ordering insulin. The Recent Insulin Administration Data drop-down displays a chronological list of the last 48 hours of blood glucoses and the corresponding insulin doses administered. This drop-down is available to review throughout the insulin ordering process. Click on the magnifying glass next to the drop-down to reveal this information. Click again to hide it. The Current Insulin Orders drop-down displays the patient's current insulin orders. This is also available throughout the insulin ordering process. To begin ordering insulin for the first time in a patient who is going to be eating meals, select the Insulin for Eating order set and click OK. This opens the insulin order form, which works like any other order set. Some orders are pre-checked and others will require you to check them. As you go through the ordering process, remember that the informational drop-downs, home meds, inpatient meds, recent insulin administration with glucoses, and current insulin display orders, are there for your reference. Of course, if this is the first time insulin is being ordered for this patient, the current insulin orders and recent insulin administration data will be blank. Check the type of diabetes the patient has. Note that diabetic education and nursing care instructions are pre-checked. There is an order to call the house officer when the patient becomes NPO. This is a critical moment to assess whether you want the patient to receive the full dose of basal insulin. In general, if the patient is on NPH in the morning, you should decrease the morning dose by 50%. If the patient is on nighttime NPH, you can keep the nighttime NPH dose the same unless the patient had a blood glucose less than 100 overnight or in the morning. If the patient is on glargine, you can generally keep this insulin dose the same except if he or she has a blood glucose less than 100 in the last 24 hours, in which case you should reduce the basal insulin dose accordingly. Among other reasons to lower the basal insulin dose is new onset renal or hepatic failure. On the following page, select glucose monitoring parameters. Before meals and PRN hypoglycemia symptoms are pre-checked. You can choose additional glucose monitoring at bedtime, 2 a.m., or at a custom time. Later in the order set, you can choose whether or not to administer insulin for the bedtime glucose. You cannot order insulin for the 2 a.m. glucose check, since this option is primarily for ruling out overnight hypoglycemia. Note the dosing guidelines that are here to help you. Among these is a reminder to adjust insulin if the patient has had blood glucose less than 100 in the last 24 hours. The blue text associated with basal insulin dosing reinforces when it is appropriate to order basal insulin. Note that 70/30 insulin needs to be ordered from the Other Insulin Orders tab. Choose a morning and/or bedtime basal insulin as appropriate. NPH is the preferred basal insulin at San Francisco General Hospital and is usually dosed once nightly or BID. Glargine is usually dosed once nightly. Glargine is restricted to patients with type 1 diabetes or those who experience repeated hypoglycemic events with NPH. There are several options for mealtime insulins. Regular insulin is preferred. You can choose the same dose for all 3 meals or a custom dose for each meal. Aspart insulin is restricted to type 1, OB, and patients on QID bolus tube feed schedules. Correctional insulin, if ordered, will be co-administered with nutritional insulin by default, and a blood glucose level will be checked prior to each dose. There are several insulin correction options for you to choose from. It is very important to note that sensitive, average, resistant, and custom are for mealtime dosing. You need to choose the bedtime or bedtime custom option if bedtime correctional insulin is desired. Click OK when you are ready to proceed to the order detail screens. Note that daytime NPH insulin would be administered at 8 a.m. Make sure you choose the right priority for your patient, considering first dose now and routine if appropriate. Nighttime insulin will be administered at bedtime. Correctional insulin would be administered as ordered with meals. Note that if the patient is hypoglycemic when the finger stick is checked, the patient will receive less than the normal scheduled mealtime dose. For example, If the patient is scheduled to receive 4 units of insulin with breakfast and has a finger stick of 60, they will instead receive only 1 unit, since 4 minus 3 is 1. You will see the mealtime dose charted as 1 unit, and the correctional scale dose as NA to reflect this. The Sign Order screen allows you to modify or delete orders if you made a mistake earlier. You cannot add an order here, so if you forgot to order something or accidentally deleted an order and want to add it back, you must start over. The order set for patients who are MPO or on TPN or tube feeds has many similarities and some differences to the order set for patients who are eating. Like in the patient eating order set, the NPO form has an order to continue basal insulin if tube feeds or TPN is interrupted, as well as an order to page the HO if this occurs. To avoid hypoglycemia, the easiest solution is often to start D10 at the same rate as the tube feeds or TPN in the case of an unexpected interruption. This is particularly true if you are using NPH or glargine to cover the tube feeds or TPN itself, i.e., using it as nutritional insulin. You have the same basal insulin options, but notice that the nutritional insulin options are different. For patients on continuous or cyclic tube feeds or TPN, there are options to give either regular insulin Q6 or aspart Q4 while the patient is receiving tube feeds or TPN. Remember that regular insulin is preferred. Bolus feeds are routinely given every 4 hours, so choose aspart Q bolus. In this circumstance, aspart will not need additional permission. Correctional insulin will be given at the same time as nutritional insulin, and the scales are the same as for the patient eating form. The Other Insulin Orders tab enables you to order one-time insulin doses, as well as 70/30 insulin. One-time insulin is useful when transitioning patients off an insulin drip, when a finger stick is out of range requiring a custom dose, or any time you want to make an exception to an already prescribed dose. Remember that when transitioning off an insulin drip, you'll want to give a dose of basal insulin 2 hours prior to stopping the drip. Insulin 70/30 is often inappropriate for inpatient use in all but the most stable patients, so consider transitioning these patients to separate NPH and regular components. If you have further questions about insulin dosing, the endocrinology department is available to consult on your patients.